Hello, my name is Michelle Hay and I'm a health and safety consultant and advisor, helping people to put health and safety in the workplace and maintain it consistently. With everything that's going on, I thought I'd put this little video together for you about planning to get people back into the workplace. The government has just issued some quite vague guidelines, but I've been working on this for a while and thinking of it in terms of what employers need to do in order to keep people safe if they're asking them to come back to work. I've put together my top 10 tips, so I'll just go through those headings and then I'll go into them a little bit more. So number 1 is about physical and mental health. Number 2, who do you really need back in the workplace? 3, confidence in management controls. 4, how are people getting back to work? 5, how can you reduce the risks of contracting COVID-19 in the workplace? 6, thinking about communal areas. 7, emergency procedures, thinking about fire and evacuation. 8, personal protective equipment, or PPE as we know it. 9, legal obligations that are still there and always have been. And 10, just paying attention to the reduction in deaths from COVID-19 up to date. So let's go into those a little bit more detail. But before I do that, you need to think about what controls must be in place. What is your business case for bringing people back into the workplace, and what work are people actually going to do? If people are able to work from home, the government's quite clear they should continue to do so until lockdown lifts completely, which is going to be phased. If yours is a business that can only continue in the workplace, such as manufacturing or printing, maybe fulfilment, warehousing, then careful planning ahead of anyone returning to work will be needed. You must be able to demonstrate a justifiable business case for having people back in the workplace if you're not classed as an essential business. So just going through those top 10 then. So physical and mental health. I would recommend that you issue a pre-return health questionnaire, or that can be done every day on the day by people as they arrive at work. Think about things you might want in there if people have had, whether they know it or not, but they've had symptoms of COVID-19, any family or friends they've had contact with which have symptoms, any existing health issues, meaning that they're more vulnerable to infection. Have you got any pregnant women? Any employees at risk people at home that they're going back to? And the current state of their physical and mental health. In other words, are employees fit to work? This should be checked daily. Do employees have a choice whether they return to the workplace, or will it be compulsory? I would recommend inclusion in decision making. It's usually beneficial. And make sure that you've got up-to-date contact details for everyone and emergency contact details. So number 2, who do you really need back in the workplace? Decisions should be based on being able to ensure the health, safety and welfare of employees so far as is reasonably practicable. Client and customer or senior management and director demands must not take priority over health and safety of your workforce. Visitors or contracts should not be allowed on site or kept to a minimum. Maybe putting something in place for the postman or delivery drivers and collection drivers that maintains everyone's safety. So you might have to have an electrician on site, but they'll need to go through the same controls as everyone else. You might want to issue a permit to work if you have got people coming on site to do specific things. So number 3, confidence in management controls. Do management and supervisors understand their roles in limiting and controlling the spread of coronavirus? What authority do they have to enforce these controls in place? And employees will need to agree to certain behaviours and controls for the health and safety of themselves and their colleagues. So setting a clear policy with the vital do's and don'ts is essential. So what is your safe system of work? Along with sickness reporting and return to work procedures. Clear guidance should be given verbally and backed up by obvious signage and supervision. Management must closely monitor the behaviours of employees. Two-way communication should be open to discuss any concerns, changes to controls, etc., and document all your safety-based activities. Number 4, how are people getting to work? If using public transport, employees will be at risk of contracting COVID-19 because they're only travelling due to work. So discuss with employees what precautions they could take if commuting on public transport. So the distancing, 2 metres apart, face masks, scarves, gloves, etc. Number 5, how can you reduce the risks of contracting COVID-19 in the workplace? You must try to manage the 2 metre distance rule. So some of the following might be useful to you. Just thinking about whether your workplace actually has enough room to facilitate the 2 metre distancing rule. If not, work out what can be done. Removing furniture, benches. If you cannot reasonably enable this, then you should not be reopening at all. How are people arriving to work? Arrival could be staggered through a work rota. This could be limited numbers in each department in work at any one time. It could be half days or reduced days and hours in work for people. At the very least, people must be kept 2 metres apart when going through doors. Could the doors be held open by someone? Someone stood behind the door, of course, so using that as a shield and a barrier. Are there different doors that can be used for in and out, creating a one-way system? All contact points must be sanitised before and after each use, so handles, keypads, that sort of thing. Please do remember that fire doors must not be wedged open. Issuing people with hand sanitizer on arrival and having it available by all doors will encourage frequent use. If considering taking temperatures of people on arrival, how will this be carried out and who will carry it out and where? Train people in the correct hand washing techniques. The NHS has a fantastic demonstration available on YouTube. If you've got lifts, then only one person at a time and sanitise the buttons before and after pressing. Stair use should only follow the same rule as banisters and again disinfected frequently. Alternative workstations can be taken out of use, forcing people to sit or stand further apart. Screens will help create a barrier between people as long as they're above head height. Sitting people back to back as well can reduce the risk, but still as far apart as possible. So what about communal areas? Number 6, toilets, breakout areas, kitchens, dining and changing facilities. These must be organised and managed very carefully and everyone must be clear on the new rules. So things like restricting access to one person at a time is critical. Disinfecting all touch points before and after each person's use. Diluted spray disinfectant and disposable paper towels are preferred for hard surfaces and will go a lot further than individual wipes. Remember, disinfectant will have a contact time, so check what it is. For brewing or tea, coffee making facilities, water point and eating areas, these could be kept out of use as much as possible. You could ask people to bring their own water bottle, flask and a packed lunch. Although, of course, at this time of year, this will need to be refrigerated. It might need to be refrigerated or microwaved. In all cases, equipment handles, buttons and controls must be sanitised before and after use. Perhaps one person could take charge of this each day. Big and bold signage at eye level reminding people of the rules will help. Use images to support a few words and take into account any non-English speaking people. If you have to get changed at work, they should put on their clothes in a clean bag and seal it. No clothes or footwear should be left on site overnight. And again, supervision of people's behaviour is essential. So number 7, emergency procedures, fire and evacuation. Review your emergency evacuation procedures before anyone returns to work. Walk the routes to the nearest exits and make sure that people can leave the building easily and without obstruction. Remind people of the safe evacuation procedures and to keep 2 metres apart whilst departing and once outside at the assembly point. Fire wardens and marshals will need to be part of the discussion. Issue them with disposable gloves so that they can quickly check the designated areas without worry of contamination before leaving the building. Practice an evacuation and evaluate what went well and what went wrong. And most importantly, record what you did to stop it happening again. Coming to PPE, personal protective equipment. In health and safety, this is normally the last in the controls used to reduce risks because it relies on humans to act appropriately. PPE is designed to protect the wearer from one or more tasks, and it must be the right kind of PPE for the risks. In this case, we're dealing with COVID-19. Disposable gloves are not a substitute for thorough hand washing. They give a false sense of security to the wearer who might be coughing into them and touching their face and surfaces, so might as well be using the bare hands. The right type of face mask may work, however, they encourage people to touch their face and the mask so it can become infected on the outside. People need comprehensive training on how to wear gloves and a mask, and how to remove them without infecting themselves. Depending on your business, work gloves, face masks and aprons might be part of daily routine. Users might just need a reminder of their purpose, the use and removal of them. So on to legal obligations. So the following regulations are just 4 that apply during this crisis. The Health and Safety at Work, etc. Act 1974 has been in place for over 40 years. And it states that every employer must ensure, so far as is reasonably practicable, the health, safety and welfare of all employees. So just to explain what reasonably practicable means, it means that the employer has done everything it possibly can to ensure the health, safety and welfare of employees, and at the very least must do the obvious. So the main regulation around this is the management of health and safety at work. So that includes making a suitable and sufficient assessment of risks in the workplace, putting in suitable control measures to remove or reduce the risk to a reasonable level, informing employees of the outcome of the risk assessment and giving employees information, instruction and training on safe working practices. The next regulation is the control of substances hazardous to health, which we call COSH. So this covers biological agents such as COVID-19. It details various control measures to avoid contact with hazardous substances. Not allowing people with symptoms or vulnerable people to come to work is a key factor here. Keeping at least 2 metres away from other people and meticulous personal hygiene and thorough hand washing standards by everyone. Coughing and sneezing into elbow or a tissue and washing hands immediately afterwards is good practice, and good ventilation and air quality may also help. Another regulation to consider is RIDDOR, Reporting of Injuries, Diseases and Dangerous Occurrences Regulations, and the HSE has updated this regulation guidance. So what they're saying is, if a person contracts COVID-19 through contact in the workplace, then this must be reported to the HSE as soon as it is known. It is a legal requirement it is illegal not to report under the requirements of RIDDOR. The Regulatory Reform Fire Safety Order 2005 also is a key factor here. Don't forget about fire safety. All employers and employees must know what to do if they discover a fire, i.e. how to raise the alarm. If they hear the alarm sound, what do they do? And the employer must appoint competent persons to help with evacuations and checking equipment in-house. So fire wardens and marshals will be needed. And it's the responsible person's duty to ensure that everyone is evacuated from the building in a timely manner. The guidance is within 2 minutes, which is usually easily possible. So 10, and finally, we have seen a reduction in the deaths from COVID-19, thankfully, but that must not persuade management and business owners that we are safer than we are. As we've seen in other countries, going back to work too early can increase the spread of infection. And if that happens, we'll all be back at home for many more weeks. This information forms the basis of a workplace risk assessment and should be used in conjunction with all other risk-reducing safe systems of work. If you need any further help and advice and support, do get in touch. I'm Michelle Hay, your health and safety consultant and advisor. Thank you.